So many of us had trouble last night figuring out how to talk to our kids about what happened and what to do if the kids are suffering, about anxiety, about going to school, worrying about their own safety when they leave us in the morning. So what's the right thing to say? Well, child psychiatrist Pete Loper with Prisma Health, he's also a pediatrician, has some advice for parents.
When you're engaging with your children, really anchoring that conversation in their developmental age and stage is super important. Again, keeping in mind kids less than 7 aren't going to really conceptualize or understand death, the permanence of death at least. And then when children ask questions, it's very, very important to acknowledge the question, but you don't have to give the whole story. It could be really, really helpful to acknowledge the question, engage in answering that question, make sure that you're answering the question sufficiently to the child's satisfaction. But you only have to give them the high points. You don't have to give all of the specific details.
All right, well, something else that Dr. Loper recommends, he says you really need to limit your child's exposure to the tragic news. Tell them the story, answer their questions, and then move on from the conversation. And we knew this conversation is just too important to have, so we actually have Dr. Loper in the studio with us from Prisma Health. We're going to be talking to him in the second half hour of Friends at 5 today about the best way for us to speak with our children about tragic events like this one.